All right. Hey, well, we're going to dive in a little bit and hear more about you and your practice. I would love to start there. So, can you tell us a little about you, maybe that sweet little baby you have, and the kind of work that you do in the world?
Yeah, so I have been in kind of my own solo practice for about 3 years, and I trained through DONA. um, and I kind of just do the full spectrum doula practice. I also do childbirth education. I'm a CLC, and I'm gonna be taking my IBCLC exam next year. So really working on that.
That's
um,
amazing. IBCLC is like such an undertaking.
oh,
So, that's
yes, oh
incredible.
my
Good for you.
gosh, there's so many things that go into it. Um, so working on that, and I do cloth diapering education. I do baby wearing education, and and I do all of those in group and individual formats. So yeah. Oh,
Awesome.
and I'm in Kansas City. I serve the Kansas City Metro. Um, but I've also gone, a little bit out of the Kansas City Metro to some surrounding cities. So
Beautiful. Thank you for that. Important to know. But
yeah.
are you working with folks over Zoom or online for now?
Um, I haven't been doing that many like virtual birth supports. I have done several in-person births at our birthing center here, because they haven't been limiting doulas. Um, so I've been doing in-person births still, but I think some of our hospitals are going back to more limited. They let off of it for a month or two, and I think they're kind of moving back towards being more limited. So I'll support people in whichever format they are comfortable with, and whichever their birthing location allows.
Awesome. Yeah, thanks for sharing that. Your baby is like, oh my
Yeah.
gosh, just like so adorable with all like the eye contact right now. Like,
He's like, stop talking. You're talking too loud. I'm trying to sleep.
ah, I know. Maybe we'll settle in. Maybe we will. I'm doing well. What are you querying right now?
I don't really know what that question means. I am just working on well, I'm also working on a class about conceiving via, artificial methods. So that was kind of where I'm focusing on for queer folks. Um, so, just trying to put that together, and then everything made me switch to virtual. So trying to translate that into a virtual format as well. So that's what I'm working on for queer folks, but really just trying to make connections with the queer community here in Kansas City so I can support more birthing folks.
Beautiful. Yeah. I mean, I think that answers the question, like
Yeah.
that's basically what that covers. I love it. Yeah, thanks. It's so great to know, a lot of folks don't like connect with other queer people in the conception part of the process too. So I'm really
Yeah.
excited that you can kind of span that. That's
Yeah.
awesome. Yeah, thanks. Well, what inspired you to do the work that you do now?
So I also have a full-time job. I work for a project that helps low-income families. The main purpose of the project is to reduce infant mortality. So, we know that Black women have the highest infant mortality rates, and so it's really focusing on that community and reducing the amount of infants that die before age 1. So we do safe sleep education and parenting education, lactation support, and all those kinds of things that go into kind of like getting folks ready to have a baby and make a person. And so I've been doing that for about 5 years, and kind of in the middle of that, I was just listening to people's stories about how they were treated during their labor and deliveries, how they felt like their providers were treating them. And we're based in a community health center. So a lot of our folks were having their prenatal care at our community health center, and then they would go to the hospital to deliver. So that means that they didn't know who the person was who was in the delivery room with them, the doctor or the provider in the delivery room with them. And so that created, another layer of issues for folks as far as having their kind of like wishes honored. You are really staring at me, girl.
Yes, totally.
um, so, kind of just doing that work, I just was wanting to get more information about like how I can support these families and making decisions about their births and about how they want to bring their children into the world. And I came across, doula support. We had a community doula program in Kansas City that is working to kind of expand access to doulas, especially for Black families. And so, I'd heard about them and I was interested in kind of delving into that world. um, so, I just kind of started from there, just wanting to provide more support for the families that I was already working with. And then after that, I got my lactation certificate and I started doing childbirth ed. And, so it's kind of just, I feel like for most birth professionals, it just kind of like spirals out of control and you're like getting all of these things and trying to add all these things to like the repertoire.
It's true. There's so many ways to have that like touch point with people in the process. But I mean, clearly you've been deep in this world for a really long time. So that's really, really awesome. Thanks for sharing all that. Yeah. And I guess in terms of supporting families more directly, do you have like a particular philosophy that you want to share that's like, you know?
Um, so I think that, I mean, there are lots of different types of doulas and birth professionals out there. And I've always kind of considered myself like more of a birth advocate. Like, I really don't care how you want to birth or like what you want to do. I just want to make sure that it happens safely and that you're comfortable when you're doing it. So I really just am more about the process. So I want to make sure that whatever that process is for you, it's, what you're looking for, and try to help maintain the fidelity of your wishes and help you get to whatever that end goal is. So.
Beautiful. Thanks so much. All right. Well, now for a part that I find fun. All right. What is your sign? We asked about your natal work and I want to know your sun, moon, rising. If you
I'm a Cancer, but I'm not an astrological person, so I have no idea what the moon rising and the sun rising thing means. Although I see that a lot. People asking about that, I'm like, I do not know what that means.
totally fair.
So I really have no idea what the moons and suns are.
Yeah, I think I'm like, it's like where those were positioned at your time of birth, like
Yeah,
this.
yeah.
But my dad and my sister are Cancers, so I feel you at least that much.
Oh.
I'm using this as an opportunity to learn more myself. I have been like surrounded by people who are into it for long enough, and I'm like, you know what? I'm gonna just go deep.
Yeah.
Amazing. Awesome. Well, what's your favorite thing about, working with LGBTQ plus people or being a queer support person in the perinatal sphere?
Um, I just really appreciate being able to have so many different family experiences, and have that reflected in the families that I see, and then in my own family. It's really great to build that community with folks and have our kids be able to see other families reflected. And just being able to make those connections with families that are same and different and look all different kinds of ways.
That's awesome. I love it. And baby's like so into it.
I
I'm so
know
glad
she's really
here.
into you right now.
We're hanging out. This is cool. I haven't, digitally hung out with enough babies and we're in
Yeah,
person this year. So
you
awesome. Well,
silly.
if you could, pick a particular thing to improve about the experience overall, conceiving, pregnancy, postpartum, for queer or trans families, what would that be?
Um, I think that even as a person who, so my wife had our first baby, and then I had this one. And so, now we've got two kids, and I think just even going through this process myself, you really don't know, especially going through it the first time, you really don't know everything that's out there and all the supports that are available. Um, and so I wish that families just knew that there are supports for the entire process. It is possible to, and I have people ask me about inducing lactation a lot, and that's what I'm really passionate about. I let induce lactation for our first kiddo to a full supply. I nursed her for 14 months. And then after that, I was like, I'm done pumping. Let's, because I spent a lot of time doing that. So, I'm really passionate about that. And I and I had just happened to like stumble across this information like pretty early on when we were starting to think about having a baby. So it makes it really difficult if you don't get that information soon enough. And so I just really wish that people knew about all the information that's available around inducing lactation, around finding support prenatally and for labor and delivery. And just, knowing that there are people out there who are interested in helping folks, create their families, multiply the love, all that.
Amazing. Thanks so much. And that's so cool that you were able to induce lactation to a full supply. Like, you should be
Yeah.
super proud. That's amazing. And I just think, so many people would love to learn from that experience.
Yeah.
Yeah, I'm curious if you have any advice for new or aspiring queer and trans birth workers, childbirth educators, queer family members.
Yeah, so I mean, the first thing I would say is to, try to network with other birth professionals in your area. Um, I don't, I mean, there aren't that many queer folks here in the Midwest doing this work. There's just some of us, but just not enough for sure. Um, and, just trying to make those connections. I'd love to have like a queer doula collective for Kansas City, and just so people will have like a starting point of where they can look to for all those supports that I was talking about. Um, so just networking with people in your community. um, and then I also think it's really important that if you decide to go through certification for any of the possibilities of things that you can get certified for, that you really do some research into that agency, and making sure that they align with your values.
That's awesome advice. Yeah, I love it. And perhaps the answer is like Kansas City Queer Doula Collective, but is there anything that you want to like cross pollinate in the community? If you're putting out feelers for anything, what can we
Yeah.
help connect with?
Um, yeah, for sure. If I know of a couple other queer doulas in Kansas City, but again, we don't have enough. And I don't know that the queer community in Kansas City knows about like what doulas do and how to reach us and that kind of thing. So for sure, trying to kind of establish that baseline of information for folks. Um, and then also, just of course, I offer all those classes and just trying to provide that information to folks. So, yeah.
Amazing. Thanks so much. And is there anything not perinatal related about your life that you want to share? It seems like you're pretty deep into the world, but
I mean, yeah, I do a lot of birth work. I also do a lot of social justice work. I help run a youth social justice camp every summer. This summer we had to cancel, so that was hard, after doing all the recruitment all spring and last fall, and then just having to tell people like, we're not able to do anything this year. And it was just going to be so difficult to try to make it into some kind of virtual format because of all of our experiential activities are so like based on being in person. But we're definitely talking about how to navigate that so that we can do more things that are a little non-traditional as far as like being in person and doing those activities. So we're talking about it. But yeah, so I'm really passionate about social justice and um, birth work, and hoping to combine and meld those arenas so that I can do all the things that I love at once.
amazing. Well, it looks like you're working on it. It looks like it's working out. You're doing amazing. Awesome. Well, where can people find you on the internet and follow you and support your projects?
Yeah, so my solo company is PG Births. It's doula and lactation services. I am only on Facebook and I have a website. I am I'm an older millennial, I guess, so I don't use Instagram um, or I'm on Twitter, but actually I'm not on Twitter. I'm on Twitter personally, but I just don't use it. So yeah.
Cool. Awesome. That's a perfectly good answer. I literally haven't used Instagram. I make Katie do it. So that's this is cool. Awesome. Well, yeah, thank you so much. And thanks to your sweet baby for being so like amazing during this recording. And we'll talk soon.